We have Dr. Lauro Jose from Mao, Manipur, and he is one of the first tribal doctor to become a radiologist in this hilly area. He has got burden of his community and he started serving through his organization called In Touch, which is specially working for the development of tribals in this area. Since past so many years, he is conducting medical camps, diagnostic camps, and surgical camps in collaboration with CDI, that is Collaborative Development International. This organization is based in USA, and through Mr. Dikomao, we came to know about this area, and we as a Gokal Charity Trust have started supporting this organization. Today we are at Mao Community Health Center, and this is second day of our surgical camp.
Yeah, this Mao area is in a very remote corner of Manipur. It is on the northernmost part bordering Nagaland. Because we are out there in the borders, the government of Manipur, yes, in spite of the fact that they try to do what is best as they can, there has been a lot of neglect. There has been a lot of needs that we see every day in the lives of the people here, particularly those that are suffering, and particularly amongst the tribal communities when they are sick and when they are either referred to Imphal or outside of the state, the nearest being in Kohima, because of the difference in culture, because of the difference in dialect, they cannot understand, and that is why even when they go even to the referred hospitals, they are neglected. And that is why we feel that unless we take healthcare system to the people themselves, it becomes very difficult for them to approach any other people. That being one. The second being because they are economically very backward. They do not have the means to meet the needs of the costly healthcare in the centers that are being provided in various private and government hospitals. And because of the exploitation at the same time that they face, it has become so difficult. And that is why I used to be settled in the city of Imphal, but because of the burdens, because of the need that is found out in the villages, I decided that we should leave that place, leave all our comforts, and then come and be identified with the people here in Mao area. And that is how we started this organization called In Touch. We have been working in collaboration with this Collaborative Development International from California, USA, since the last almost 12 years now. Before that also we used to be conducting multiple health camps. Those are mostly free health camps, and we go on doing things like that. But because of the fact that we do not have much support from any other organization, external organizations, that is why we used to try and see if we could take minimal charges from the patients so that we can sustain ourselves, we can run these facilities. But because of various problems, other than trying to meet the basic care, the basic needs of the people, it has become very difficult for us to provide any other supportive, curative interventions like surgery or laboratory cares or any other to make them mobile, take them from one place to the other whenever there is requirement. And so we are, in fact, this time around, we are very thankful to JVGCT Charity Trust because they have given us one of the core needs that we have. Patients needed to be transported from these places. They are poor, suffering, and yet because of the lack of transportation, they cannot move out. And in spite of the fact that they want to, they cannot. And we cannot take the medical personnel to their places all the time. And that is why the support that you have given in this form has become a very critical need even for our area. This is one critical area that we are looking at. Lai Circle is very far away from national highway, and then it is very interior, and because of which I think it is good that we will be able to give them at least to some extent some access to medical facilities.
Dr. Lauro, you have been like a very good motivation for most of the doctors here from the Mao area, as well as you are conducting medical camps. Apart from the medical camps, what are the other activities you do through In Touch?
Yeah, In Touch is an organization, as we say, we reach out to meet physical needs. The best way for us to be able to affect or impact upon the people, it may be moral, it may be ethical, it may be various other social issues that our communities face. Unless we are able to meet physical needs, it becomes very difficult for us to make inroads into the community. And that is why we think that reaching out to these people need motivating them to go in for education, motivating them to go into various technical studies if there is a possibility, or maybe even trying to motivate them to go for healthcare examinations. Unless we are available, presenting them with certain physical needs, meeting some of their uplifting some of their troubles, it becomes difficult. That is why we do this. And now, a single person or a single organization cannot do that. And so we identify the like-minded people in the community or organizations that can come alongside us to be able to walk with us the extra mile and present to the people the needs that they have. We thank your organization especially for coming around us. You're far away from Maharashtra, and yet you have heard about us and you have come to be part of us. Now you have come with some other doctors who are of great use to our people. Their support here is definitely going a long way.
Definitely, we would like to support community for health need as well as other needs too. And I will convey your message to my board of directors as well as trustees. And I hope that small help what we have given through JV Gokal Charity Trust may be used to the needy people. And we'll try to give some medicines, whatever is possible from our side in near future. Which villages you are going to conduct the health camp in near future, or maybe tomorrow or day after tomorrow?
Yes, this team, the CDI, has come alongside us, and we have roped in the Rotary Club of Mao too. There are a number of doctors, professionals who are also having this motivation for service about self. And so we thank our friends here to be coming alongside us. So together we are going to, tomorrow, after today, we'll have all the surgical camps. Yesterday we were able to conduct 17 major cases. A few of them are pediatric hernias and hydrocele, but we are thankful that our people appreciated this initiative and they have come. And today also there are a number of cases that needs to be done, and that will be done, and that tomorrow we hope that there are lots of patients around us wanting to get some healthcare system. So we will try to provide this tomorrow. But day after tomorrow we are going into a village that is typically poor and distant from all these facilities, and so we are going to a place called Makhan Plain. It is one of the big villages around here, and that needs a lot of care. So we're going there.
Thank you, Dr. Laro. And then along with you, I have seen many government officers, government doctors. They are working here, and I think they are of great support.
Yes.
They have given you the infrastructure to use since we don't have enough infrastructure.
Right.
So I would like to ask our government doctor. She is working here, and then let's hear what is her opinion about this camp being conducted here. So can you ask? Yeah, please.
Now, see, we are thankful that the government has their own infrastructure, their own people, manpower that are placed here. There are some difficulties. We are thankful to the people who are around here with us these days. But this team is not will not continue to remain in the same place for a long time. And when government establishments, people change, then attitudes also change. And that is why we have been always wishing that if there are some sort of infrastructure, basic infrastructures that can be built up, through which maybe those who are interested, those who have the burden, can come together there and then try to provide whatever service that we can give to our people. And so this is one very critical component. Now, of course, I have Dr. Gairelu, who is a senior doctor from this CHC Mao. She and her husband and some of her colleagues, they have been very supportive, and so she can give her views too.
Hello, doctor. As we were talking about the health camp conducted here in collaboration with CDI and in touch with help of your local MLA, Mr. Tikko, we're also trying to give little help. I just want to know your view about this camp, how it helps community, because you as a doctor, you are working in the government setup, you know the healthcare need better. So how these camps are helping you to cater needs of the local people?
Of course, this health camp is helping us quite a lot because we especially Hindi people cannot go to the either Kohima to Ifa. They cannot afford, especially finance. They have got a financial problem. So every year this American team used to come and they have conducted, like in the past many years, like in 1 year they have conducted surgery 31, 32 and sometimes more than 35, 36 cases. So it's helping us quite a lot, especially in the Mao area. I really thank you. Your Gokal Charity Trust also is helping us quite a lot. And not only that, Dr. Loher's his project or team also now helping us quite a lot. So we are very much thankful to you. And
We appreciate your help because you are opening your infrastructure for us to have a platform and try to give little help. And most of the government hospitals, they don't allow outsiders to come and work here. But you as a team, being a local, you are always welcoming our team as well as Dr. Lawrence team to help these people. And this is not only that you are giving the treatment to one person. As a public health specialist, I always look this as our whole community. We are trying to reduce community disease burden, and indirectly it is helping us to reach our Millennium Development Goals by reducing disease burden. Though you see a small number of patients, but if you are thinking only in terms of direct cost, but you are really helping community or really helping families to reduce their disease burden by reducing direct cost. I mean to say, whatever money they are going to spend in the private hospitals, you are giving this in free. Secondly, the transportation charges you are reducing. And third most, it's very important, we always call in health economics as the intangible cost. That is reducing stress of the patient as well as family member and community. And that plays a very important role in public health. So thank you very much for catering a community and giving good services at the doorstep. This is the way our doctors, those who are motivated by Dr. Loro and some of their senior doctors, they are serving community. You see many patients are waiting here to get their checkup done here. Dr. Loro has got portable ultrasound. I've got Dr. Sanjay with me, and he is helping him to do the ultrasound, because just for ultrasound patients need to go to the Kohima or Imphal, which is very far away from this area, and expense for traveling is too high. There are some surgeries conducted yesterday, around 17 surgeries they have conducted, and each surgery approximately cost around 10 to 15,000 per minimum.
It will be minimum 35 to 40.
It will be minimum 35 to 40,000, and that too at their doorstep. And I have been coming here since last 2 years. I have attended these two surgical camps here, and patients are so happy. Patients are so excited to get their surgeries done here at the ground level without spending time, money, and that too at very minimal stress level. Thank you very much, and thank you, doctor, for continuing the community service. We look forward you to serve more in future. We will, as a charitable organization, like-minded organization, will also try to help you in the future. Thank you. Thank you very much. Thank you.